Our conversation with Dr. Ralph May is presented by Marcus and Mack, a law firm representing injured people. He's on the phone with us this morning. Dr. May, good morning.
Good morning, Todd. How are you?
Wonderful. It's good to have you on the air with us today. So we talked with you at the beginning of the coronavirus pandemic, and we said now people are going to find themselves in their homes for extended periods of time, sometimes with family, sometimes without. We just heard the report on loneliness now is becoming a real problem. Mental health, emotional health, they're two different things, but very closely related, and both affected by the pandemic and by social distancing and staying home, aren't they?
Absolutely. I think it's interesting, too, in looking at the study you just cited. We talk about how young people like social media and they use social media and social media is so great, and it is, but they're the ones that are being differentially impacted by this sense of loneliness that we have to have human contact. Human contact is an extremely important component for us in order to maintain good mental and emotional health. We're social beings. We require that kind of face-to-face, personal interaction with individuals. While the Internet, why social media, Facebook, Twitter, all the various platforms are helpful to stay electronically connected, they don't really meet the full needs of the social connectedness, seeing and interacting and touching another human being. We're wired that way. We really need it. We can go for a period of time without that, but we notice it when we don't have it.
61% of American adults say they are free, have feelings of separation and isolation, and it's affected them mentally and emotionally. So let's talk about what people can do to offset some of those effects.
Well, obviously, one of the most important things to do is to remain connected as best as you can with the available technology. Interacting via social media is not the same thing as being able to interact face-to-face, but it's still interaction. It's still an opportunity to connect, converse, share. You can share video, share audio, but the idea being is you're still interconnected with other human beings. And even in social distancing, you're discouraged to go out in public, but I think being outside of the house, just seeing other people at a distance or seeing things moving. I mean, I know just coming down Philadelphia Street, because I'm still essential personnel at the Guidance Center, just coming down Philadelphia Street, you see practically almost no one, but you do see cars, you see people moving about, so you know the world has not ended. You're still seeing the world is moving. It's just you don't have the same level of connection that you wish you had. And I think another thing that's important, Todd, is the idea of this is a temporary thing. Human beings need to know time. They need to know time frames. They need to know how long a trauma is going to last, how long a challenge is going to last. We don't know exactly how long this is going to last, but we know it is temporary, that we will get back to normal, probably in a phased manner as things improve. So also it's important to tell yourself mentally, which helps with the emotional reaction, that this is still a temporary arrangement. This is not going to last years, that we will be back to normal. It's just going to take a little time to get there safely.
We have heard from a number of different sources and read a number of different sources that said one of the things you need to do is make sure that what you're consuming in terms of entertainment or information isn't all coronavirus, COVID-19, dire circumstances. You have to find a way to actually find entertainment.
Exactly. I mean, you want to stay informed, you need to. But even myself, I get bombarded with the state and the federal information and local information, insurance information. I mean, if I just looked at my email, I would become incredibly depressed because you're just seeing all the negative aspects of things to stay informed. So you have to have some information, but you also have to limit it. Watch a little bit during the day, but also balance what you're doing, what you're watching, what you're listening to. Enjoy some fun things. You know, watch some old movies that you enjoyed. I used to love Bugs Bunny cartoons. I wish I could find some Bugs Bunny cartoons, but I think you have to go to the Internet to get them. I haven't done that yet. But just do things that really just lighten your mood and lighten your spirit and help you laugh.
Hey, Ralph, Looney Tunes every afternoon on Cartoon Network.
Thank God. Thank you, Todd. That's a big help. You just helped me a lot there.
Well, whatever we could do to help. There's nothing like the Barber of Seville with Bugs Bunny.
That was one of the best ones.
Get you through your day. Yeah. So that's a wonderful diversion, if you will. Physical activity also has to be a part of that equation too, doesn't it?
Absolutely. And this is where I believe getting outside and walking, just being out in the sunlight, getting fresh air, maintaining social distancing, of course, But getting outside of your house when you can and walk, or work in the yard, or do something that just gets you physical activity and exercise. You don't have to go run a marathon, but the goal here is to stay physically active. And this is particularly important because there's a lot going around about people eating more comfort food, right? We're feeling, more confined, a little bit more sad, a little more frustrated. So people I saw something about SpaghettiOs the other day where everybody's wanting SpaghettiOs. The issue is if you start eating like that, you're going to get in what we used to call hibernation syndrome, where you start gaining weight, you start getting more sluggish, mentally kind of depressed. So fight that. Enjoy some snacks, but get out and get moving.
Yeah, absolutely. Now, we've heard reports and statistics show that there's been an increase in domestic violence incidents. We have to be sure that we're getting along properly with those with whom we find ourselves isolated a little bit. Parents and children, that's one the dynamic of this all. And of course, husbands and wives, people who are living as adults in situations where maybe they're around each other more than they thought they would be ever. But it's a pretty serious thing when domestic violence becomes a part of this, isn't it?
It absolutely is. And remember, when we confine human beings into spaces where they don't have freedom of movement, the natural tendency is to become more irritable. And that happens in a lot of individuals, whether you have any pre-existing mental health conditions or not. And so the irritability, the frustration tolerance gets lower. People get more frustrated with one another. It increases difficulty. So it's important we need to pay attention. I also heard that the alcohol sales in the United States have skyrocketed, and we have to be careful there, too, because the consumption of too much alcohol combined with confinement can lead to increasing rage, irritation, frustration, and that can fuel interpersonal violence, verbal and physical interpersonal violence. So I do recommend that if you are limited in your movements, which we are, is make sure you have ways to go to your neutral corners. One room versus another room. You have private time to decompress. No matter how much you may love someone, no matter how much you enjoy their company, you need to have some private time, some separation time to allow for some decompression.
We're talking with Dr. Ralph May, the Community Guidance Center. I have talked with all of our Indiana County School District superintendents and principals in the last couple of weeks. We have Purchase Line Superintendent coming on with us in our next hour. One of the questions I'm always sure to ask them is, with your school psychologists, your guidance counselors, how are you dealing with the mental fear that students might have at this time, students who have never experienced anything like this? None of us ever have, but certainly students never have anything even close to this, and we really have to guard their mental health.
Absolutely, and you want to, with many things, you have to maintain the middle ground. You have to be guided by the question of the child or adolescent. Young children really react based on adults' reactions, so you have to measure your own reaction. It's all right to have a little bit of fear, but don't let the fear paralyze you into not knowing what to do. We can all do something. Young kids, just being able to distract them, being able to engage in games, let them have fun, explain what we're doing and why, but don't go into too much detail. With adolescents, it has a lot more to do with social justice. What do we need to do? How do we prevent this in the future? Reassuring that we will be all right if we do the right thing, we do our part. And I think so it's important to remain giving a sense of control to people, as much control as they can have. So, what you can do and what you can't do gives people a sense of I'll get through this, I have a plan.
How have things been at the Community Guidance Center since this has gone on? Has there been an increase in calls? Is it running steady?
We're actually getting an increase. We've seen a lot more calls, people who are coming in. Some people that have existing depression and anxiety, which we don't talk about them very much, but they're under particular pressure. Though some who are used to being socially isolated, this is kind of normal for them. But others, it's really difficult because they're cut off from their natural support systems. We've gone to using telemedicine, telepsychiatry, and telecounseling at the Guidance Center, which is working fine. We're seeing a lot of people that way. We're doing all our evaluations tele if we can, though people can come in if they absolutely need to. People have been very good about asking for help, and we've been getting them in as quickly as we can, which is pretty good. But the demand is higher. Coroner Overman and I are watching, what's happening to the suicide rate in Indiana County. There has been no appreciable change in that, which is good. I am worried about when things start to lessen, that people get very much in a hurry. They want out quickly, and we go too quickly. And I want to make sure that as the curve flattens and things get better, we don't rush back to normal too fast and put ourselves in danger. We have to be careful.
Yeah, my next question was going to be about the Suicide Task Force of Indiana County. I'm sure they're on high alert because it's really important for people to know that resources out there and that there is somebody to talk to always.
Always. The crisis line in Indiana, which is 877-333-2470, is a 24/7 number. It's staffed by a clinician, so you always have someone to talk to. You don't have to have a serious mental health concern to do that. You can just use that number for support, to answer questions, how to talk to your kids. There's also a tremendous amount of information from the CDC and from SAMHSA, the Substance Abuse and Mental Health Services Administration, about how to talk to your family and kids about COVID-19, and it's really good stuff, scientifically validated. So there's a lot of good resources out there to help people. We just want to make sure that even though people feel lonely and isolated, the help that they need is still right at their fingertips, just like it's always been.
You know, State System Chancellor Dan Greenstein put out a Twitter video yesterday on which he said, you know, we're going to treat this as a gift, something from which we can learn and apply in the future, the lessons that we learned today, and maybe come out of this with some better ideas about how to approach situations such as this, because it's going to happen again someday. In your
Eventually
field,
it will.
In your
Eventually
field of mental health, I'm sure those same lessons, you seek those same sorts of lessons and the same application for future treatments.
Absolutely. I mean, we're learning about how people react to this kind of stressor. This is a unique stressor for us in this day and age. It's happened before, but never in this day and age. And so we're learning about people, how people cope well. We focus sometimes on how people react badly, and certainly there are those stories. But also listen to how well people are coping, how well we're pulling together, how many people are rising to the occasion. We're taking care of one another, and we're helping one another, and altruism is being reborn. We go through these crises in history, these real significant crises in history, and sometimes they pull us together in ways that we didn't even think possible. So I think we're going to learn that there was a tremendous amount of resilience and altruism and positive experiences that came out of this very terrible thing.
He is Dr. Ralph May, the Community Guidance Center. Somebody wants to use your services or get in touch with you, what do they need to do?
Call the Guidance Center at 724-465-5576, and we will help you.
Very good. Thanks so much for spending some time with us today.
Thank you, Todd. Thank you, Todd.